Welcome to the video. Today we'll break down the top 7 face oils that most often truly help skin look better. Hydration, barrier support, softness, a more even tone, less tightness, and less flaking. A quick note right away. This video is for educational purposes. Everyone's skin is different. If you have severe breakouts, dermatitis, rosacea, or allergies, it's better to discuss your routine with a dermatologist. And yes, test any oil with a patch test on a small area of skin. There's a simple rule. If your skin is oily/acne-prone, choose lightweight oils that absorb quickly. If your skin is dry/dehydrated, you can go for richer, more nourishing oils. If your skin is sensitive, fewer fragrances, fewer hot extracts, more calm, gentle oils. One more important thing, oils don't hydrate the way water does. They work like a lid. They help retain moisture and support the barrier. That's why it's best to apply oil on slightly damp skin or over a moisturizer. Jojoba is an oil people often describe as similar to the skin's sebum. And that's not a marketing metaphor, it's chemistry. First, jojoba is technically not exactly an oil. It's a liquid wax. About 97 to 98% of its composition is wax esters, not triglycerides like most plant oils. Because of that, jojoba is very stable. It oxidizes more slowly, goes rancid less often, and usually stores well. What does it do for the skin? The logic is simple. Wax esters form a thin film that reduces moisture loss, softens the surface, and supports the skin barrier. That's why jojoba is often loved by people dealing with dryness, tightness, and flaking, especially in colder seasons. What does the research say? There is data suggesting jojoba may show anti-inflammatory effects. In an experimental skin model, applying jojoba wax reduced inflammatory signaling markers by about 30% compared to untreated skin. There are also clinical observations in a clay mask plus jojoba format for mild acne. One study reported a noticeable reduction in the number of lesions over several weeks. But it's important to understand, this isn't a magic cure. It's gentle support within a routine. Jojoba is obtained from the seeds of the shrub Simonsia chinensis. The raw material is usually cold-pressed. Sometimes gentle extraction is used. Then the oil is filtered/purified. How to use: 1 to 3 drops on slightly damp skin or over moisturizer as a moisture lock. Squalane is one of those things that looks like an oil, but in feel, it works like a smart, lightweight protective layer. Squalane is an inert, very stable emollient. It helps skin feel softer, reduces tightness, and supports the lipid barrier, meaning it acts as a layer that reduces moisture loss and makes the skin surface more even and calm. Another plus people love it for: it's commonly considered non-comedogenic, meaning a lower chance of clogging pores, so it's often chosen by people with combination or breakout-prone skin too. In dermatology reviews and patient-facing materials, squalane is most often described as a gentle ingredient for dry, sensitive, and even acne-prone skin, precisely because of its neutrality and barrier support. It's not a medical pill, but a solid building block in skincare. When the barrier is stronger, skin usually reacts less and tolerates actives better. Modern squalane is usually made from plant sources, for example, olive, sugarcane, and others. First squalene is obtained, then hydrogenation is performed to squalane. A working dose for the face is usually small, 2 to 4 drops. It's best applied on slightly damp skin or over moisturizer to seal in moisture. If your skin is oily, start with 1 to 2 drops and adjust by feel. Rosehip oil is one of the most popular options when you don't want a greasy film, but want the feeling that skin looks more even, softer, and calmer. Rosehip is valued for its fatty acid profile. It usually contains a lot of linoleic acid and alpha-linolenic acid, omega-3, plus a smaller amount of oleic acid, omega-9. Linoleic acid is one of the fatty acids skin especially needs when there's dryness, flaking, or that thin skin feeling. Rosehip also contains natural antioxidants, tocopherols, vitamin E, and carotenoids, which is why the oil sometimes has a golden orange tint. These components are often linked to a more alive tone effect and support against environmental stress. In skincare, rosehip is most often used as a gentle helper for dryness and tightness, dull-looking skin, uneven texture, the feeling that skin is tired. It's important to understand. This isn't an instant filter or a treatment. It's a careful support tool in a consistent routine. What do research and practice suggest? In scientific and cosmetic literature, Rosehip often shows up as a source of fatty acids plus antioxidants, which makes sense to connect with barrier support and reduced oxidative stress. But results vary from person to person. For some, it works perfectly, and for others, it can cause a reaction, so it's best to introduce it gradually. The oil is usually obtained from rosehip seeds/fruits, often Rosa canina or related species, by cold pressing, then filtered. Cold pressing matters because it preserves sensitive components better. A starting, working dose, 2 to 3 drops for the face. Best at night, the oil can give a noticeable finish. If your skin is sensitive, start 2 to 3 times a week, then you can use it more often. Apply on slightly damp skin or over moisturizer. Argan oil is a classic choice when skin needs more comfort, softness, and nourishment, especially during windy seasons, indoor heating, and dry air. What works in it? Argan oil is rich in fatty acids, most commonly with a lot of oleic and linoleic, omega-6. This duo matters for the barrier. Oleic acid gives that soft, slip feeling, while linoleic helps support the protective layer of the skin. Plus, argan is known for a high content of tocopherols and other antioxidant components. In practical terms, that means the oil doesn't just grease the skin. It can help skin handle dryness, cold, and irritation from the environment. What properties it has? Argan is often chosen when there's tightness and dryness after cleansing, flaking, and a rough texture, the feeling that skin gets red faster from wind/cold, a need for a richer finish at night. It doesn't treat skin like a medicine, but it often helps make it look smoother and feel more comfortable to the touch. In scientific and cosmetic literature, argan is usually described as a source of fatty acids plus antioxidants, which makes sense to connect with barrier support and reduce dryness. But it's important to remember, reactions are individual. For some it's perfect, and for others it can feel too heavy. The oil is obtained from the kernels inside the pits of the argan fruit. The kernels are dried, then usually cold pressed, then filtered. In cosmetics, a version without a strong scent is more often used. Additional purification. How to use. A working dose. For the face, 1 to 3 drops. It's best applied on slightly damp skin or over moisturizer to help retain moisture. If your skin is combination/oily, start with 1 drop and see if the finish feels too rich. Grapeseed oil is often called the lightest option when you want to try a face oil. The main feature is a high percentage of linoleic acid, omega-6. That's the fatty acid often associated with a more lightweight feel on skin and barrier support without heavy greasiness. The formula also usually contains a bit of oleic acid, omega-9, and natural antioxidants, including forms of vitamin E, tocopherols. In feel, it's often one of the most dry oils. It absorbs faster and shines less. In everyday skincare, grapeseed oil is more often chosen for light softening without heaviness, reducing the feeling of tightness, supporting the barrier when skin is dehydrated, but also gets oily easily, a more even, smooth finish for evening routines. It's not an acne medicine, but for combination skin, it can sometimes feel more comfortable than richer oils. In cosmetic practice, oils with a higher linoleic acid content are often considered more suitable for skin prone to comedones than oils dominated by oleic acid. The logic is simple. The texture is lighter, and the risk of a heavy occlusive layer is lower. But a lot still depends on the formula, the dose, and your skin. There are no universal guarantees. The oil is obtained from grape seeds, usually by cold pressing or extraction, then filtered. High-quality versions are typically light in color, with a neutral scent, a sign of good purification. How to use. Neutral. A working dose for the face is usually small, 1 to 3 drops. The best method is on slightly damp skin or over moisturizer, as a layer that helps retain moisture. For oily/combination skin, it makes sense to start with 1 drop and evaluate the finish. If you use it in the morning, finish with SPF, because oil by itself does not protect from the sun. Marula oil. Extracted from the kernels of the fruit of the African tree, Sclerocarya birrea, has in recent years become a gold standard in dermacosmetics. It's often called a lighter and more powerful successor to argan oil. Here's why it's considered essential for facial skin health. Biological mechanism of action, marula oil, has a unique chemical profile that allows it to work on several levels of the epidermis at once. Fatty acid composition. It consists of 70 to 78% oleic acid, omega-9. This makes the oil's molecules small enough to penetrate deeper than most plant oils, providing nourishment without the feeling of a heavy film. Antioxidant shield. The oil contains a high concentration of vitamin C and E, as well as flavonoids. This helps neutralize free radicals that break down collagen and accelerate photoaging. Amino acid profile. Marula is rich in L-arginine and glutamic acid, which help retain moisture inside cells and restore a damaged protective barrier. What do studies say? Scientific data supports marula's strengths in hydration and protection. In clinical studies, it has been shown that regular use of marula oil significantly reduces transepidermal water loss. It acts as a smart occlusive, sealing in moisture while still allowing the skin to breathe. According to stability tests, marula oil is 60% richer in antioxidants than popular argan oil. This makes it one of the most effective natural options for wrinkle prevention and for reducing the effects of stress, air pollution, UV exposure. Despite its high fatty acid concentration, studies show that marula oil has low comedogenicity. It has natural antimicrobial properties, which helps reduce acne-causing bacteria. How to use and what to pay attention to. To get the best effect, it's important to follow these recommendations. Look only for 100% unrefined cold-pressed oil. Refined versions lose up to 80% of their antioxidant properties during thermal processing. 2 to 3 drops are enough for the whole face. The oil can be used as a standalone step after a hydrating serum or mixed into a night cream to boost its nourishing effect. It's ideal for dry, dehydrated, and mature skin. For oily skin, it's recommended to use it locally or only in the evening. Marula oil is a powerful bioactive component that combines the lightness of a serum with the nourishing strength of deep care. It is clinically effective in protecting against premature aging and restoring the lipid barrier. Important. Before adding a new oil to your daily routine, it's recommended to do a patch test on a small area of skin to rule out individual intolerance. Oat oil. Oat oil is a unique lipid complex that dermatologists value mainly for its ability to repair a damaged skin barrier. Unlike many other oils, it contains the same types of lipids as our skin. Biological mechanism of action, ceramides. Oat oil contains a high level of ceramides, up to 1%, phospholipids, and glycolipids. These substances literally patch holes in the skin's protective layer, preventing dehydration. Avenanthramides. These are powerful antioxidants unique to oats. They have a pronounced antihistamine-like effect, quickly reducing itching, redness, and irritation. Vitamin E in the form of tocotrienols. The oil is rich in the most active form of vitamin E, which protects the skin from lipid peroxidation under sun exposure. Studies show that oat oil can mimic the natural lipids of the stratum corneum. This makes it a gold standard for managing eczema, dermatitis, and increased sensitivity. Clinical tests confirmed that avenanthramides in oat oil suppress cytokine activity, inflammatory molecules, which makes it useful as a soothing step after aggressive peels or retinol. Who it's for? People with dry, atopic, and hypersensitive skin. Features: it has a light herbal nutty aroma and a medium richness. It works especially well as a sealing oil in cold weather.